If you discontinue to watch this video at one point, please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine today, atrial fibrillation, and after we've done it, we're gonna do squat training. And if you participate in the squat training, then is that at your own risk. And we're talking about internal anatomy, the blood system, diseases, and this is no medical advice. We're just reading it and trying to understand it. But we're reading it now for the third time, I think, and we're trying to go over the text and try to gather the information together which we want and try to make an out-of-memory representation about atrial fibrillation. An irregular beating of the heart is atrial fibrillation. The atrium is the chamber of the heart from which rhythmical contractions spread to the rest of the heart. In atrial fibrillation, the contractions lose their rhythm and the heart beats irregularly. Atrial fibrillation may occur in sudden, intermittent attacks, but more usually it persists once it has developed. Older people are most affected. The heartbeat spreads from the atrium out from the top part of the heart, out over the whole heart. The atrial fibrillation, there is the rhythm not properly. Symptoms, palpitations, we looked it up, that is feeling the heartbeat, feeling their own heartbeat of a person is that. It can be because of fear or shock or something, fear, but also because of atrial fibrillation or something. So palpitations means feeling that the person feels their own heartbeat. Shortness of breath, vague feeling of tightness and unwellness, sometimes symptomless. Okay, palpitations, heartbeat feeling, a bit of tightness, weakness, and unwellness. Tightness was weakness, not. Tightness, unwellness, shortness of breath. Duration. Intermittent attacks may last minutes or hours, and they may recur over many years before becoming established. So maybe there are just some intermittent, so just an attack of it, but it lasting for some minutes or hours, when it goes away again. But it can then recur over years until it is established permanently. Persistent atrial fibrillation lasts forever if there is no treatment. Causes. No underlying cause can be found, and oftentimes it can be congenital, born in, and it can be thyrotoxicosis. That is, we looked it up, that the pituitary glands are producing too much, and that causes the thyroid glands to make a toxic reaction, or was it the other gland? Overactivity of thyroid gland due to overstimulation by the pituitary gland at the base of the brain. It causes toxic reactions in the body. The condition is also known as Graves' disease. Okay, thyrotoxicosis. The pituitary glands are too strongly stimulating the thyroid gland. The pituitary gland are overstimulating the thyroid gland, and that leads to toxic reactions in the body. That can also be caused thyrotoxicosis. Complications: heart failure with congestion of lungs and swelling of ankles. This will cause shortness of breath, palpitations, or an irregular pulse. And it can cause pulmonary embolism, so that one of the pulmonary veins is blocked. It can lead to heart failure, swelling of the ankles, shortness of breath, palpitations, and pulmonary embolism. Thyrotoxicosis. It is the thyrotoxicosis, as it's the thyrotoxicosis, so that's the thyroid glands. Thyrotoxicosis. Treatment in the home. Sit down and rest. When to consult the doctor as soon as possible if an irregularity of the heart rhythm is suspected. What is done? If the heart is still beating irregularly at the time of examination, the doctor will usually be able to diagnose atrial fibrillation when he or she will often confirm it by an ECG, a tracing of the heart rhythm. If the attack has stopped, he or she will be unable to say for certain what caused it and will look for an underlying cause. he or she may prescribe treatment to help the heart beat more slowly and effectively. Okay, there we have it. If it is through an echocardiogram examined, found that it is it, then there is treatment to help the heart beat more slowly and effectively. As there is danger of blood clots developing in the heart, anticoagulant drugs may be prescribed. In this case, it will then be necessary for the patient to have regular blood checks. More slowly and effectively, that was maybe not just a short-term treatment. So the long-term treatment are anticoagulant drugs. Prevention. Little is known about preventing atrial fibrillation. Outlook. With medical treatment, atrial fibrillation can continue indefinitely without ill effect. Okay, atrial fibrillation. Let's start the camera and try to say it. Atrial fibrillation. The heartbeat comes from the atriums and spreads over the heart, and by atrial fibrillation that beat is irregular. The symptoms, they are palpitations or feeling the own heartbeat and shortness of breath and a vague feeling of tiredness and unwellness. It can be symptomless. And I have no idea what the next thing is. The thing how long it lasts, that is symptoms. Atrial fibrillation. Normally from the atrium at the top of the heartbeat spreads over the heart. By atrial fibrillation, that heartbeat is irregular. It has as the symptoms when palpitation, feeling the own heartbeat is met, and also shortness of breath and a vague feeling of tiredness and unwellness. It can be symptomless. At the beginning, just one attack, an intermittent attack, lasting for a few minutes or hours, and then we're getting more often until after some time it is persistent, if there's no treatment. And it can lead to complications. It can lead to pulmonary embolism, heart failure with congestion of lungs. And now the cause, it can be congenital. Oftentimes no cause is found, so there's also nothing known how to prevent it. It can be also thyrotoxicosis, that is that the thyroid glands are the pituitary glands are overstimulating the thyroid glands. And that causes for toxic reactions in the human body. No, but it's oftentimes not known or found what it is. And there are if it is still very atrial fibrillation when it is examined, then it can be found good. Otherwise, this is tried to found, and there is then done an ECG and an electrocardiogram to find out if it is it. There is also some treatment to bring the heartbeat more slower and more effectively, but the long-term treatment are an anticoagulant drugs. And they have to then checked through blood checks from time to time that they are properly. And if it is all happening, the anticoagulant drugs, then the outlook is good and the person can live on. That is according to Keith Hodgkin's Family Medical Advisor book on the page 82 and 83. But this is no medical advice. I'm going to stop the same camera. And that was the medical part. If you go here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the squat training, then it's very honest. You're bringing one leg up, pull the leg up and point with the toes down. Upper leg. Legs to the side, and we're doing 12 squats. So first one down and up. Let's go on with the second and the third one. And now number 4 and 5 and the 6. We're having the half. Let's go strong into the second half. This is already the 8th one. Number 9 and 10. And now 11, the last one. 12. Now the 6-pack squat squeeze exercise. A bit down into the knees, quarter squat, and press against the top of the leg, only on one side. And press on the other side. Down into half squat and press in the middle of a leg. And on the other side. And down into 3/4 squat and press close to the knee. And also on the other side. And up again. Now, the fastest you have of a water pond exercise. Down into 3/4 squat and press against the knee and go towards on the other side. Press. Go towards it again. Press. Go towards it and again press. Go towards it again. And again. And last two. Press. And the last one. And up. Already the last exercise, the propeller. Legs wide apart. Down into foot squat. Arms to the side. Over to one side. Press against the leg. Look up to the head. The middle to the other side. Press against the leg and look up to the head. And now stretching. One heel onto the ground. Pull the toes in and move the leg from left to right. Other heel onto the ground. Pull the toes in and move the leg from left to right. Take the foot at the ankle. Make a straight back. And point the knee down to the ground. Other leg. Straight back. Knee down to the ground. Legs wide apart and breathing around. Breathing out. In and up. Out and down. Breathing in across the legs. And breathing out. That was the squat training. I thank you very much and to the next time.